to you. And the situation given in any country is extremely volatile. So therefore, don't expect things to be the same by the time we get to the next week. So we'll take it as it comes. So that's why we have specifically mentioned even on our guideline and the letter that we have shared with you that we are assessing it on a daily basis, looking at how things are, and we will do what is best by the students and the staff, and be ready to adapt to whatever the situation that comes. And then we have to understand that this disease will not leave us for a considerable time. Even if there is a vaccine, the chances are for us to get the vaccine, it will take at least a year or two. So we have to get ready for the new normal. So the part of this new normal is to get ready for situations like the current cluster that we are having. So a lot of people are taken by surprise, but I think this is what we have to accept. Like, okay, this is what we have to expect and accept that's going to happen in the future. Clusters like this will keep coming up as long as we have our borders open, and then the cases are being managed. Somewhere, sometime, something will go wrong, and then a cluster will come. But do have faith. We had 35 clusters in Sri Lanka when nothing was prepared in this country. And we were able to extinguish all those clusters within about 45 days. And then it was confined to the Navy camps and the quarantine centers afterwards. So if we were able to handle 35 clusters, handling a few clusters again is not going to be a huge issue. So that is provided that the support from all sectors are continuing as we move forward. So I mean, there are certain forces that we might be able to control, then there are some things that we might not be able to control, but if all goes well, just like the first wave, we should be able to control anything. Then we have to understand we are all stakeholders of this process, like including the parents, the teachers, the old boys. Everyone is a stakeholder in this process, and everyone's opinion was considered during the development of the guidelines and the process. It was not just the doctors and the school. I think there was an open invitation by our subwarden sir for the parents to also express their concerns if they have any. And I think a lot of old boys, distinguished old boys who have like expert knowledge on this regard have contributed, whose names are not, because that's our way of doing things. We don't go by names, we go by the organization that we represent. So a lot of people have worked behind the scenes whose names are not seen anywhere. So it's a collective effort that you've seen at college. So yeah, so something that we haven't mentioned, but we have to lay this at the very beginning. Stigma, which is being developed, and since we are planning to start school, once the children starts coming back to school, every parent have to make sure that they have addressed this concern with their children, that nobody will be stigmatized within the premises of the schools and beyond, because this is one family where we do not divide people based on race, gender, religion, anything. Therefore, even if somebody has been exposed to the virus, that is just normal, because any one of us could have had the virus, because this is just another respiratory illness and it's not the fault of anyone to contract this virus. Therefore, if you know anyone who has had it and if they have been declared clean, that means they're clean. There is no difference between you and the person who have got the illness or who is the relation of a person who has had the illness. Therefore, at the very onset, I would lay this down straight. No stigma will be tolerated within the school premises, because it's worse than the virus if we really allow something like this to spread within the school premises. Okay. Moving on to the facts, this was a cartoon that was shared on today's newspaper. Right, these are the issues that the typical Sri Lankan schools would encounter. But luckily for us, well, I wouldn't say that we don't have all these problems, but COVID-19 is the one that is in the center for us. Because at St. Thomas's, we have been able to manage all the other ones, and we do have the ladders working properly. But sadly, the truth in the other schools are that they don't even have running water, some of these schools. And we have to be grateful for what has been provided for us, because we don't even have to think about all the other aspects, but focusing completely on the COVID-19 situation. that is a blessing for us, and we have to be grateful for what has been provided for us. So, okay, this is the current situation in Sri Lanka, and all of us are dreading the final peak that we are seeing at the end of the chart. So, the most important thing that you need to understand, there's another graph that shows how many symptomatic and asymptomatic cases were there. So that means people who actually had symptoms and got diagnosed, and people who were diagnosed just because we tested them. So if you consider the last part of it, it's mostly asymptomatic people who were tested positive because we tested them. So that's the trend. But world over, the situation is not looking so good, right? But you can see that the number of daily cases are going beyond 225,000 per day now. And there's a bit of a different thing with the amount of daily deaths, which is actually on the decline. So when the cases were less than 100,000, there were more deaths taking place on a daily basis, whereas now the number of deaths have come down. So one thing is that they might have been missing the diagnosis, or there can be so many other reasons, but there is a change in the viral virulence as well. So those things are up to the experts to decide, but this is just observing the data that is being presented. Okay, so before we go on to discuss anything, I think I don't have to explain what the coronavirus is, how it came to be, because I think that has become general knowledge for people. So we all know that it's a coronavirus that is a zoonotic that has crossed over from the animals onto the humans, and some data analysis have shown that there are 3 different strains, but not something that will affect the immunity as far as we are concerned as of now. But they are saying there are 3 varieties, but they have all been circulating. But let's focus on 2 main documents that have been released by the World Health Organization, which will clear some of the doubts that we have been having about the system. So a lot of people are having this issue where the government keeps saying, okay, we found someone positive, and 3-4 days later we say, okay, the tests are becoming negative again, and people are developing conspiracy theories saying, okay, the government is hiding bodies, the government is hiding tests and all. So this is what the WHO has to say about it. So they have actually gone ahead and changed the discharge criteria for patients as well. The reason being that some of the people who are becoming positive for the PCR are actually not having a disease that is replicating. The virus is not naturally progressing in the body, nor can that person give it to another person. But however, the PCR test keeps coming positive because of the presence of RNA within that person. So for this reason, on the 17th of June, the criteria for discharging a patient from isolation was changed. So what they are saying now is, if somebody is tested positive, from the day that the person was tested positive, 10 days later, you have to be isolated or be on the treatment center for at least 10 days. But after 10 days, if you are symptoms free for 3 days, then they say you can even be discharged without getting a PCR test, because the PCR test can keep becoming positive for months to come. So therefore they are saying it is putting an unnecessary burden on the system plus the person and the society at large if we go by those criteria. Then for asymptomatic cases, people who do not have any symptom but who have been diagnosed merely on the testing facility of PCR, after 10 days they could be sent home without getting a test. Then they are explaining why they have made these changes. I explained a few of them earlier. Long periods of isolation for individuals with prolonged viral RNA detection after resolution of symptoms, affecting individual well-being, society, and access to healthcare. So that, luckily for us, is not a major issue. So therefore, it's not the thing. And insufficient testing capacity to comply with the initial discharge criteria, that again is not an issue right now. I know that our testing capacity is not one of the best, but with the given patient load, it has not been an issue. We actually did not even utilize the maximum number of testing facilities within the last few months because it was not needed. And the third one is the most important one: prolonged viral shedding around the limit of detection, having negative results followed by positive results. So this is what has been happening in Sri Lanka. So you get a positive, and a couple of days later we say like he was tested 5 times and he turned out negative. So this can keep happening, and people will start losing trust in the system and the laboratories This is not what the government is saying. This is not what the health system is saying, but this is what the WHO is prescribing. So if you have any doubt, you can Google the criteria for releasing COVID-19 patients from isolation and find the document and read through. So, okay. So they go on to explain the current understanding of transmission risk. I have actually straight away taken off the document so that, you know, it is very transparent, not like, you know, edited anything. So, so people have to understand that, okay, infection with the virus causing COVID-19 is like, we are assuming that when somebody has the RNA present in their body, that the person is having the actual virus affecting them and it's able to infect them. But actually it's a surrogate marker. It's a, I would say, a proxy measure where you think, okay, if the RNA is there, the virus is actually able to cause the disease. But however, they have found that during viral cultures, that's what the WHO is saying, when they culture it, most of these patients are not able to have a virus that can propagate. Therefore, there has to be some understanding on who needs to be kept inside and continuously investigated, and who could be let out even though they are having the RNA positive. So again, to tell you that Sri Lanka is not following this protocol. We are going with the old one where we are testing till we get a negative result. So the current criteria in Sri Lanka, as far as I know, I don't know whether it has been changed within the last 2-3 days, but what we have is 2 negative results within 24 hours. So we are taking, even though the WHO is prescribing the lenient ways of doing things, we are actually going one step further, and we are actually practicing the hardcore way of doing things, and we are taking the maximum burden on the system and doing it the best possible way. So just like how we are doing things at St. Thomas's. And then about the prevention, a lot of people have we were all expecting what it would be, the declaration by the WHO about the aerosol spread of the disease. So there were a lot of documents going around. There are still valid research saying that, okay, there is aerosol spread of the disease, and that some are saying no, there is none. But the WHO has given, okay, after considering all that, to prevent the transmission, this is the set of guidelines that the WHO has given. So I think it's fair for us to go by this. This is not what the Sri Lankan government has given or what we are thinking, but basically what the WHO is recommending. So to prevent the transmission, they are saying, okay, we are doing all this: identify suspects as quickly as possible, identify, quarantine all close contacts that we are doing, use fabric mask. Now this is the part where we need to pay attention. Use fabric masks in specific situations. For example, in public places where the community transmission, so it goes on to say where there is community transmission. Sri Lanka never went into the level of community transmission, right? So that's level 4 of disease spread. But they are prescribing fabric masks for countries that have community transmission. But however, Sri Lanka has decided, even though we do not have, we are going to recommend the masks. And where other prevention measures such as physical distancing is not possible. Then, we'll move to the most important one. So, use of contact and droplet precautions, we have to do that. So, this college has taken every possible precaution to prevent the droplet spread through fomites, and the contact points have been reduced. And some of our distinguished old boys who have experience working in the field and who have advised the private sector on, figuring out these touch points and running through a school, have come on board and supported school to identify these touch points, and all the touch points that could be avoided have been avoided within the school premise. So we have done it to an extent that no other institute, I think, has taken up in the government sector. So, continuous use of medical masks by healthcare workers, and all the other things that we have prescribed: good hand hygiene, respiratory etiquette, social distancing. Those things have to continue till we are sure that this disease is out of this country. So, and one other important thing to highlight is the good environmental ventilation in all closed settings. So we are again blessed with one of the best buildings in terms of ventilation. this school was built when there were no ACs. We have not had, like, we don't have a situation where we are having, classrooms without windows. So we have plenty of this. And I think it's been well documented that the disease spread on a setting like ours is minimal. So moving on. Right. So that's about the introduction. I don't think I have to go into detail about the precautions that have been taken at St. Thomas's to make things even more safer for you guys and the kids. So some of them, I'll just list them now, like things like having pedal operated sinks at the entrance itself is something that some of the biggest schools in Colombo have not been able to do. So if you consider the time taken for students to come in, and for them to, because what they are prescribing right now is for each child to wash the tap on their way out. So that is going to be extremely unpractical, like, when you're having thousands of kids coming through. And we have moved to pedal operated sinks. And then even the school bag, I think we might be the only school where the school is providing all the learning material, the station, we are just, the school students are expected to bring a pen, the lunch box and the water bottle, and all the other things are provided from school. That's the extent the college has gone to ensure that the safe environment is maintained for the kids, because we have seen that the flow is becoming positive in most of the treatment centers and most of the places. So keeping the bags on the ground and then picking it up, keeping on their lap and using them might be a good vector for disease transmission. So that's why that decision was made. Apart from that, even when a child wants to go to the washroom, there's a protocol that has been devised. There's a person who's in charge of the washrooms who would continuously keep cleaning all the touch points. This is like a top-end private sector establishment that is providing every single thing. As Father said, yes, there are some things that we cannot do, but those things I don't think, like, even some of the highest level organizations are able to uphold. But St. Thomas has given you the best possible environment to do this. So I request all of you to be grateful for what has been provided, and if there are any concerns, I think it should be raised directly with the school authorities so that those things can be addressed in a very professional manner. And I can guarantee you that the best possible administration is available at college right now, and all concerns that are practical will be heard and they will be addressed. And so a few more things that people want to know, and I would first open the session to Dr. Kapila now give me a second. To describe about, like, the administrative situation, because Dr. Kapila is directly handling with the government and knows the entire situation from the top level, how things are happening and what is the real situation in the country. I think it will be very useful. I hand it over to Dr.
Kapila. Thank you, Ashan, and good evening to all the parents and the staff who have joined. It's great to have joined in to this webinar and to share the situations with you all. Yes, now as you know, with this COVID-19, the health sector played a huge role. Everybody knows it, with the other stakeholders like the Triforces, the police, the district secretaries, the divisional secretaries, plus the other grassroots level officials who are under them. There's been a huge network of people who have been working right throughout over the last 3 months. And so they are continuing as well. Now, once these patients are located, they are immediately taken to, if the patient is, as Dr. Ashan said, we are going beyond the recommendations of the WHO, where they say, the WHO says, okay, if the patient is positive, still they can be in a quarantine center and be isolated. But here in Sri Lanka, when a patient is found positive, that patient is immediately taken to a hospital, not a quarantine center. So you can say that the IDH, the Homagama Hospital, the Ragam Hospital, and so many hospitals like that, because the Ministry of Health has dedicated 22 hospitals to treat these patients. And as you know, recently, or the recent situation, even Kandakadu, the center, that's the quarantine center, has also been turned into a hospital to treat those people. So all these positive patients are in the care of the doctors in a hospital, and the rest of the people are the contacts actually. So these contacts are immediately quarantined. Now, even last 2 days, if I take, for example, from Ratnapura, we found out 4 people who have had contacts with the patient, the person who was found positive, and they were immediately, some of them were even taken to some quarantine centers in Valisara, and the other contacts, the family contacts, have been quarantined immediately. And now these quarantine people will be under quarantine for 14 days, and these people are also uh, they're each and every day by the PH. You know, that is the kind of network that we have in Sri Lanka. I don't
Dr.
think this
Kapila,
exists
Dr. Kapila, you are breaking up.
anywhere in
Can
the
you keep your
world.
vehicle
So the
stationary and
PHIs,
address
the
this?
so this is how it goes. How is it now?
If you can keep the vehicle stationary and then address the group would be best, because you're breaking up, doctor.
Yeah, I'm stationary at the moment.
Okay, that's great.
Yeah. So is it okay now?
Yes, much better. Yeah.
Am I? Yeah. All right. Okay. So so what I was telling was, now all these people, you get the positive patients and their contacts. Now the contacts are in the houses, quarantine, and they have been monitored daily by the medical officers of health and the PHIs and the other health staff in the field. So there is no one missed. There will be no one. That's why, exactly why, as Dr. Ashan said, that we don't have a community transmission at the moment. So that way we are safe, and we are trying to keep it safe. But as he said, anything can go wrong at any time. So we have to be careful, and we have to adhere to the quarantine regulations given by the health ministry and the government. Okay, right. So over to you.
Right. Thank you, Dr. Kapila. So that is the situation with the country right now and the protocols that have been followed. So I will now open the session for Dr. Sanjeeva Gunasekara to speak to you about the pediatric situation. A lot of people are discussing about this Kawasaki syndrome, and like thinking that it's actually a complication of the COVID-19, whereas we as medical students even have seen plenty of cases of Kawasaki. It's a different disease entity, and I think Dr. Sanjeeva Gunasekara will take up on that regard.
Thank you, Ashan. Just for this initial introduction, I will just talk about the Kawasaki's disease, which caused a lot of concern among parents during the lockdown period, and I think it was doing its rounds on WhatsApp groups and various stuff, increasing the anxiety. Basically, what is this Kawasaki's disease? It's not a new condition. It has been for ages, as Ashan mentioned. Am I?
Sanjeev, your voice is breaking up. I think even if you can disable the video, I think that will help if the bandwidth is not enough.
Sanjeev, we can't hear you at all.
Hello? Yeah, sorry, I just dropped out. Can you hear
Okay.
me now?
Yes, yes.
Yeah.
Clear.
All right. I don't know whether you heard the first part or shall I start from scratch?
We could hear it, Sanjay. So it's just the last sentence that we missed.
Right. Okay. So Kawasaki's disease, so it has been there for a long time. It's nothing new. So it's usually seen in children between ages of 5 to 10. They usually start with a fever and a skin rash, and can sometimes progress to red eyes, enlarged lymph nodes. And the critical thing about here is that sometimes it can affect the heart as well. The basic the reason for all these symptoms and signs, we think it's because of an immunological response. That means, when we get an infection, either a virus or a bacteria, the body tries to fight that. So when we, the expected thing is that when we try to, the things which the body produces to fight that infection will take the virus away, kill it off. But as a side effect of that reaction, sometimes what happens is that the body, that person also can have cause some damages to that person also. So that's how the heart and all can get damaged. Why was this in the conversation in last month or so? Was because in some countries, doctors noticed that where there was widespread community disease, COVID-19 was spreading widely in countries like Italy, UK, and the USA. They noticed that there was a little bit of an increase of this Kawasaki syndrome and similar syndromes in children. And it has caused few deaths, not many, but few deaths as well. So they highlighted it so that the doctors can be more vigilant and expect this in children. But again, as we know, COVID-19 in children doesn't really cause very extensive disease. The children do quite well. Most of them recover without any complications in a short time. So even although we see this slight increase in the Kawasaki's disease as well because of the virus, it still doesn't take away the fact that children with COVID-19 do very well. So, and if you take Sri Lanka, where there wasn't any extensive community spread at all, we have not noticed any increase in the Kawasaki disease in the general pediatric wards. For Sri Lanka at this point of time, I don't think this is Kawasaki. This is something that we should worry about or be overtly concerned. So if it manifests, it always can, because how does COVID-19 causes the damage to the lungs and the other tissues is also like the Kawasaki's disease through immune-mediated process. Even although we know that can happen, I don't think that is of much concern to us at this point, and certainly not something that parents in Sri Lanka should worry about. Right. So I'm happy to answer any questions later on, and I will hand you back over to Ashan.
Thank you, Sanjay. I think that explains everything that you need to know about the scare of Kawasaki disease within Sri Lanka, and some people went to the extent of speculating that Sri Lanka had a spike in Kawasaki disease as well. Some of the people who could not understand that it was just a normal phenomenon that's happening in Sri Lanka on a day-to-day basis. Even today, if we check some hospitals, the primary treatment centers for children, you would find a few cases of Kawasaki, but that has nothing to do with the COVID-19. So now moving on to the more interesting part of how things are handled in other countries and how it works in the healthcare setting, as well as a parent who's sending the kids to school in the UK. What are they doing? And because it will always be nice to get a perspective of what's going on in a different setting. I mean, supposedly a more developed setting. So Bimantha, over to you to explain the situation.
Thank you, Ashan. And thank you, Warden, for giving me this opportunity. As a matter of fact, I have vested interest in this meeting because I'm a part of the PTA, and my children would be returning back to St. Thomas's once my stint in the UK is finished in a few months' time. So I was very much looking forward to this meeting today. However, Ashan wanted me to just brief what I have gone through here and what's the current situation in the UK. So you all must be aware that UK was probably one of the hardest hit countries. At the moment, they have about 280,000 positive patients with almost 44,000 deaths. And at its peak, it had almost 1,000 deaths a day, but it has come down now to almost 50 a day. So that shows that the virus had spread quite a lot. In fact, I'm sure we all got it and recovered without any major problems. UK was put to stage 4 and stage 5, and now it has been come down to stage 3, where all the lockdowns have been eased, just like in Sri Lanka. And coming to schools, now I'm in the ENT specialty. However, we had a lot of patients with COVID-19. We were put to the forefront. We dealt with COVID-19 patients one-on-one, which put our families at risk, put our children at risk. And this was a very difficult time for all of us here. However, the schools, I'm not going to go into the politics of who made a correct decision or not. However, you are all aware the UK definitely fared much worse than our country in Sri Lanka. However, they definitely did pick up from where they fell down. Now, one interesting thing is they did not stop all the schools, especially for the doctors' children, because they needed the doctors and nurses to go to work. So they managed to get the children into school and looked after the children on their behalf. So that was one difference we saw here. And then coming to restarting school, I think St. Thomas's has done absolutely a fantastic job. And definitely it's in par with what they are doing here as well. The only difference is over here, they started with year 1s and 6s because they were the least, they were the children who actually were quite asymptomatic, if you even see with the current data. And they were the children who really were they found it very difficult to handle. So they needed to be taught what is hand washing, how to social distance, how to respect others' spaces. And this was the main concern we were told as parents. So they sent us letters by letters by letters stating that we have to teach our children that please keep 2 meters, because unlike in Sri Lanka, it's 1 meter, but here it's 2 meters. And one thing we notice when we are walking on the road is if there is a person coming, we would always stay on the side and let that person pass. And we were made to teach our children before we send them to school, that this is a habit they should inculcate. The next thing, we were, as parents, these are the things they told us to do. Then they said, reward the children when they do this. Don't impose them to do it. Reward them when they do it. Afterwards, they opened the schools for year 1s and year 1s and preschool. And year 6, that's like our scholarship year. When they went to school, all the children very nicely kept 2 meters apart. They all washed their hands and they were all taught to wash their hands. They made it a fun activity. And anyone who did extra washing was rewarded in school. These are the little things I learned, because I'm sure teachers would agree. This age group, especially in the lower school, they are the ones who would be the most vulnerable. Why are they the most vulnerable? They are not the problems. The problem is they go and stay with their grandparents, and that's the vulnerable age group. So it was a big concern even in this country that the small children would take the disease back home to their grandparents. So they were really taught how to keep the distance even with their grandparents, even with their parents at home, washing the hands all the time. all had to wash their hands before they enter class and after they leave class. And I think college has also put all the necessary things in regards to going to the washrooms and things, which they are doing the same here. Then there was another thing which I would like to bring to your notice about Kawasaki disease, which we did encounter here, exactly as Dr. Gunasekara said. When and a few of these patients were referred to us because of the lymph node enlargement. There was a concern, but however, as of now, they are not too worried about it because, as you know, it has not exponentially increased and there is really no risk for children in that sense. So that's reassuring. As a person who saw this to our own eyes, we used to see Kawasaki, but it really didn't increase more than what it should be, at least in our area. It's very important as parents that we inculcate these values at home rather than enforcing them. We need to show them what the problem is and how we can get out of it. When we do that, the children will abide to our whatever we say, because that's what's shown here. And I can see a good example of our kids. They would come and tell me, Tati, you're not washing your hands properly. You know, Tati, you should move away from that person who is walking on the road. That is the sort of thing we have to inculcate our children to do. Once that's done, you will see it's a very easy process. And that social distancing is the key. Washing your hands is the key. And obviously in Sri Lanka, we wear the masks, and that is key. Over here, there is a little change. They don't allow children to wear the masks in the classroom, which lots of parents are objecting for obvious reasons. But they have the UK guidelines says that you don't need to wear masks in the classroom. However, when you go out of the classroom, you have to wear, and you cannot socialize, you cannot play as usual. How they have done here in the UK is they've broken the classes into two. So for 1 week, one half would come to class, the other week, the other half would come into class. And then they basically do the other weeks basically online. But I think St. Thomas's is doing a fantastic job with the online training in that sense. And I would like to take any questions if you have any, but that's basically the perspective of England at the moment. Thank you.
Thank you, Bhimante. I think that gives you a different perspective of how other countries are managing the same situation. That's why I said at the very beginning that it's still an evolving disease. There is no consensus among the international community as to which drug to use, what is the best way of prevention. So all these things are still being discussed, and different countries have different policies. But the most important things from our side is we have to take into consideration our cultural context and our geographical context. All those things have to be considered. And on top of that, the current disease spread. Because just to wrap it up before you break into the groups and come up with the discussion. So some countries that have actually controlled the disease really well, like New Zealand, they have a staggered, I think even England has a staggered way of like saying, okay, what is the risk level, and depending on that they take measures. Unlike Sri Lanka, where we're having like all or none law, like either you're in a shutdown or you're okay to do anything. So people freely move about. So what they do is at level 1, they go back to normal life. I mean, you might have seen the Super Rugby matches being played and with stadiums full, and yeah, nothing really bad happened with that, because they were so sure that they did not have a single community case in that country. And level 2 comes when there are a few cases and they start practicing all the preventive measures again. Level 3, that means there are clusters. So you go into like, okay, people who do not have to go to work will work from home. You go to the maximum possible level of precautions, and then you still operate. And level 4 means a shutdown. Right, only the most essential workers will go to work. And likewise, so a staggered system was presented today to the Technical Evaluation Committee of Sri Lanka as well. So we presented it just today, and it was taken up very well. And let's say within the next few days to weeks, we might actually have a very robust and a meaningful way of doing this job when things will become much clearer as to when to wear a mask, when not to wear a mask, when to practice socially, because it's fun. I mean, some of the things are ridiculous, so I'm sure those questions will come during the question and answer session, like, okay, people come jam-packed inside a bus, and once they get down to college, you have to keep the 1 meter distance and all that. So a lot of questions like that. So yes, that's an issue, but as Warden said, there are things that we can control, there are some things that we cannot control. So we will do whatever we can to the maximum possible level, and the rest we'll just have to hope that the system will improve. So I think Father Kendall, I think the lecture part is over. We can break into groups and take the questions.
Okay. So what we're going to do now is I'm going to break you all into 8 rooms. And in those 8 rooms, there'll be 8 scribes who will jot down your questions. I have quickly spoken, or I have just asked a few impromptu. I'm just asking a few. So Sanjeeva Palyavadana, Thilan Vikramasinghe, and Refuge, if you can be the others to help us out. Others have been spoken to before. So what we would like you all to do is, I will now click on a break into rooms. What you need to do is, when a particular line will come, join room, you click on that and you will automatically go into a small group. And once you go into the small group, our request is you post all your questions and doubts that you may have to the scribe of that group, and they will jot it down. And in 6 minutes time, you will come back to the main room, and the scribes will be given an opportunity to throw your questions. This is just for the fact that we don't want, we have 240 participants. We don't want 240 participants at once talking, just to control that. Okay. So I will be opening the rooms. When I open the rooms, just click on join room and you can go into that particular small room. Thank you. Click on join room now. Roshan, you'll be also reading a small room. Father Roshan. Click on join room. Thank you. Yes, many of you are leaving the main room and joining the rooms. Thank you. Click on join room. There is about another 70 more to leave the room, the main room. Click on join room. Click on join room. Yes, another 70 more. Click on join room. On your screen, it would appear join room. Click on that. Refuge, you need to click on join room so that you can go into your room. Yes, thank you. A few more are here in the main room. If you can click on that join room. Yes, we have 50 odd left. Just go into those rooms so that you can continue your discussion there. You can ask all your questions there. Just few more. Click on the join room. There is a lot more in this main room. If you can just click on the join room, you will go into a particular room, like a small group room. Few more. If you can click on the join room, it will make it easy for the moderator or the scribe to take down your questions. There you can unmute yourself and you can ask all your questions. A few more. If you can click on that on your screen, there will be join room. Just click on that. Click on join room. Join room. Yes, that's right. A few more. If you can click on the join room, not the main room, go into the small groups room. Yes, Kanishka, click on the join room. Click on the join room. Just click it once and you will go into a small room. If you click it again, you will come back to the main room. Just click it once and you will get into a room. Channa, you can do the same thing. Desmond, Darshi, Jiva, Jay, Manulka, if you can click on the join room. Tilan, if you can click on the join room. There is about 40 odd in this main room. If you can click on join room, you will go into a room where there'll be a moderator who will ask your questions. On the right hand side, you will see join room, like a join room will come up. Okay, for those who can't find it, let me moderate it for you. So if you have any questions, I will open the questions. Okay, so if you have any questions, can you ask me? I will take it from you. I have unmuted you. If you can ask any questions, unmute yourself. I have unmuted. I've given you the option to unmute if you like. If there's any questions, yes, ask me. Yes, ask me. If there's any questions that you have that you would like to ask the doctors, if you can ask me, I will ask it from the doctors. We just got another roughly about 3 minutes. Yes, Kanishka. You're unmuted.
Yeah.
Yeah.
Yeah. So when will school start for the grade 4?
We have still not made a final decision on that, but we can ask that from the warden. Now, if you see all the chat room,
Okay.
the warden had actually responded to that. So Akura will inform you whatever the question, what the details are.
Okay. So yeah, and I'm sure all the health guidelines will be followed.
100%.
Yeah. So and also they need to wear masks.
Instructions will be given. Now, if you saw the letter that was sent, the letter
Yes,
also
I
gave
did.
those clarity. Yes.
Yes. Yes.
Any other questions from anybody else?
Are they also going to have 1 week for one batch? Are they going to divide the class into?
Okay, so this is reopening procedures. Any medical questions?
Are they going on class?
It will be a blended learning style. I think in that letter warden sent to you all on your children's on the Akura page, on the web page, all those details are there. But Akura will give you the information, and the letter of warden is quite clear on how it's going to happen.
Okay.
Any questions that we can ask the doctors?
Mr. Asanka?
Any questions that we can ask the
Hello?
Yes, tell me.
Mr. Asanka, one more question.
Yes. Ask me.
Yeah, by considering the current situation in the country, because now you find from different places, I mean, there are certain, I mean, you find certain people who are infected with corona. So what my question is, under the present situation in the country, is St. Thomas's in a position to commence the school on the 20th? This is my question, please.
Warden would address that. When he started the meeting, he addressed it. But
yeah,
we will ask that question from warden again once we recommence.
Fine. Thank you, Mr. Asanka.
I'm Kendall, actually. Sub-warden.
Sorry.
No problem.
Sorry. I couldn't recognize the voice. Sorry.
No problem.
Yeah. Thank you.
I have a question. Hello. If you wear a face mask, do we have to wear a mask?
Hello. Hello.
Yes, Anuk, tell me.
Yes, actually, I'm Anuk's father. Kendall, I just want to know, the Ministry of Education has recommended to do the, entire sanitization process in the college premises, to disinfect the entire premises. Now, my question is that really necessary? Because the school has been in isolation for, about 3-4 months. And have you got any plans to do it? And is it necessary?
Okay. I will ask that from warden. We'll ask that from team. Thank you, Anuk.
Thank you.
Okay, I think most of the people have come back from the rooms and few are still coming in. So we will ask the questions from what we have got. So can I ask Chintaka if you get your questions ready and ask the panel of doctors first, and then we'll go at them one by one.
All right, thank you. Generally, we got a very good response. I mean, most of the parents came out saying that they're very happy with the arrangements made by college. So on a very positive note, so most of the parents said that they were very happy that actions taken by college. There was a question by one parent. I would like the parent to take up this question. Nilo. The name of the parent was Nilo. Nilo, can you ask the question from the panel doctors?
You can unmute yourself now, Nilo. No, can we, looks like she has not come on. Can we move?
Okay. Maybe she would not want to come online and speak, but
Yeah.
anyhow, that was also, I don't think this is a question to be answered by any doctor, but by the administration. So there was a question raised, are they still enforcing haircuts? So I don't know the relevancy of this. So I'll have to ask Warden. All I could answer was, I know my son is sitting the O-level this year. So the prefects had told him to cut his hair. So I don't know. I can ask Father Mark.
Well, you can see my hair, no? No. I mean, I have told the teachers that no matter what the situation is, that is not an excuse to let down our standards. So the rules of the school, the expectations of the school will remain, whether it's haircuts or shaving or all those things. Because if you are bringing people back to school, then and they're coming into the school environment, then the disciplines of the school must remain, no matter what the situation.
Any other
Father
questions,
Kendall?
Chintika? Yeah.
That those are the only questions that I
think,
had. And
Chintika, if I can explain, I think the concern might have been about taking to a salon and like whether they can get a haircut or not from a salon. But as Father said, most of us are just going on a clipper, right? So those things are widely available, and yeah, and they're really cheap. So even for us, we haven't visited a salon for for a haircut, but like, you know,
this is self-done. This is self-done. All self-done. Part of it is the loss. Part of it is the loss of running the school, but part of it is self-done.
What if that cut is allowed for the kids? I think they will agree.
Mother's cut.
Thanks, Father Mark, and thanks, Dr. Ashan. Those no more questions from my side.
Okay, so may I go to Asirini? Asirini, you are also made a co-host. Was there any questions from that group?
Yes, Pastor Kendall. Actually, all my questions from the parents were, I think, Father Mark or Ms. Asanka will have to address. So can I bring these questions, or am I to be quiet with them? Father Mark?
Father Mark, move on. You need to unmute yourself, Father.
I think it should be okay. I mean, these may be some questions that are common to everybody, unless they are specific. Unless they are specific in terms of individuals, and you want clarification, you can ask things that are in general.
Yes, things are many are general questions, Father. One is if the situation gets back to lockdown situation, whether the online classes will continue and children coming to school will stop. Yes. Then
that will definitely happen, and online classes will continue because our online classes are actually doing very well.
Okay, Father. Next question is child to enter. What gate they have to enter when school reopens? I think Akura message will go, Father. Is that
correct?
Yes. Yes. Then some parents in the KG section are very happy with the Akura instead of online. So just to continue that situation, because they are working parents and they will like that to happen instead of online.
That will also continue, Asiri.
Yes. Next is Father, the upper school especially, and even the lower school is asking for a recorded version of lessons, because some now they have started going to work. So the facility of providing an equipment is not available. So therefore, if there is a form of recording the lesson and having it uploaded, if you can do that facility. So parents are requesting that from you too.
Can I ask a subwarden to respond? I think there is a feature for that as well. Subwarden, are you on?
Yes, Father. So the classes are recorded, as if I'm not mistaken. A lot of the teachers are recording the classes. However, the problem in uploading is that teachers also struggling for the data. But they are recorded at the moment, and when able, those will also get uploaded. The issue with Akura is that it's only a one-way stream where you can upload only documents, which is why we have gone to use Google Classrooms, which can handle documentation plus the videos. Now, how I would do it and how I have been doing it for my maths classes is that I would upload the class presentation along with the video of the class, of the online class which actually took place. So a child can watch it at whatever time. And this is something we're going to follow for the rest of the students as well.
Okay, thank you, Subwarden. Last question is when is the O-level term exams going to be held, Father Mark?
Gordon, can you answer that too, please?
Sorry, was that O-level or A-level?
O-level term exams.
O-level term exams, they've not set a date yet. What will most probably happen is that it will be after elections, after we have had a couple of weeks after elections, so that everything is come back to normal. But you will get a notice about that soon enough.
Okay, thank you, Subwarden.
We intend to, all things going well, we intend to close down after the elections for a couple of weeks, because quite honestly, our teachers have been working non-stop from the 20th of April. And we thought that there may be some online classes for exam-based classes, but otherwise we want to give them a bit of a break. So we're looking at different options in the month of August. I think even the teachers have been working very hard, and they also need a bit of a break from classes, especially the online. So let's see, we'll keep you informed. I mean, everything can change tomorrow with the way things are going. So we can't really tell you exactly now.
Okay,
Thank you, Father Mark.
To add to that, Tasani, they said that the A-level dates are not out yet either. Because once are scheduled to be held in schools have to close down again because we can't have anything else because the A-level exams. So there's a lot of things up in the air at the moment. So we can't give you exact dates. We're going on a month-by-month basis, and that too will probably come to a week-by-week basis based on the most current situation.
Thank you,
College will
Subwarden.
be an exam center for the A-levels, and usually they only take one of our blocks, but this time with the necessity for spreading the children out more, they will probably take more than one of the blocks, which means the entire school will have to be shut down for them to have the A-level exam here. Of course, the boys will not like that because social distancing will affect their plans for assistance, I suppose.
Thank you, Warden.
Okay. Thank you, Asirini. Sudat, any questions from your group?
Yeah, technically there were some concerns with now we allow the water bottles, pencil box and the lunch box to come in, and whether the kids have separate places to keep them or they have to keep them with them so that somebody doesn't touch it. That's one question. Other is, have we had any conversation with the transport vans of any concerns, or with the parents who are sending their children in vans? Have we had any communication? Right. Other is there's one.
Sudat, shall we respond to those?
Sorry.
Shall we respond to those, because it might be too many things that Warden has to answer.
Okay.
So, Subwarden, answer the matter of the what they are bringing to school. I'll speak about the vans.
Yeah, so the lunchbox and the water bottle and everything, what they're supposed to bring, they keep it because they have their own, the tables they're assigned to won't change. So once they come in, they keep it on the tables. So it's not something other boys will go and look at, or other boys won't go and sit in the same chairs. So it is isolated in that sense.
With regard to the transport,
With regard to the transport, Sudat, we have spoken to the van drivers. We had a meeting for the van drivers about a week or two ago, and they have been told about the requirements where the interior of the vans are concerned. Unfortunately, we have absolutely no control over the van drivers because they are private vans which have no connection to the school whatsoever. So the parents also need, the parents who are going to use the school vans need to take some responsibility and look into that themselves, because there's a limit to what the school can do with these private vehicles.
Exactly. So other is how long is it advisable to wear a mask for a child?
Doctors can have to answer that, Ashan?
Yeah. Yes. So right now, I think you might have heard two stories. One coming from the Ministry of Health side saying that it is not required to wear a mask within the class, and from the Ministry of Education side saying that it is a must to wear a mask within the school premises. So as far as the college is concerned, we should go with the recommendation of the Ministry of Education, because we are under the purview of the Ministry of Education, and by any chance, if we do not follow some of those recommendations and by any chance coincidentally we get a case, everybody will start throwing the blame at us. And I think Bimantha also explained why in the UK, they actually do not encourage the children to have a mask. I think it was brought up during the staff discussion as well. Child wears the mask during the public transport, gets down from college, and then wash their hands and goes inside. If they keep touching their mask afterwards, they're actually again introducing the germs back to their hands. So actually it's a logical question, but the problem lies with the recommendation given by the Ministry of Education. So until they give us a directive, the best we can do is for children to change the mask at the entrance. They have to carry a zipper locked bag where it can be safely packed in at the entrance and wear a new one probably going in. And then considering that it's a known group of people, see, when we move forward, the most important thing that's happening worldwide is that they keep track of where people have been and whom they have been communicating with. I think Bimantha explained the other day to me that even at the pubs in the UK or any restaurant, they would take your name, address, and from where you came from, so that if a case comes up, they can always trace back. That is fully available within the school. And if I address one more question that was raised earlier about the gates, unlike the time when the bomb situation was there last year, for no reason we can allow a child to come through a different gate for any reason, because this is what we call zoning. Because if we get a positive case, we have to make sure that particular child was limited to a certain area. But if that child was allowed to move through another gate, then we'll have to close down the entire school. So because we have to be prepared for the worst case scenario, because we will have to deal with this for the next 2 years going forward. So those demarcations will have to be made. But with regard to, yes, I know it's impractical for a child to wear a mask and keep, and even for us, it's very difficult in a hot, humid country like ours to wear a mask and wait. But as far as the situation is, we have no say in it. I don't think even the college administration can make a call on it, because it's the government that's making the decision.
Just to make
Ashan?
just to make the scientific side of this, based on the scientific evidence, what children are required to wear is a face mask, even a cloth mask. Now, a cloth mask should not have any impact on the child's breathing or activities under any circumstances. Doctors wear the medical masks for hours. We don't have a big problem with that even while we do surgery. Probably the FFP3 mask, that is the highest level of mask which we wear on active COVID patients, they do cause a problem. That causes a lot of tiredness and things like that. But in no means should any child or any person in the community wear such a mask. So what is recommended by the Ministry of Health and Ministry of Education and the WHO is you wear a cloth mask. If it's clearly seen, it's a cloth mask. and that should not hamper a child's health. I think that's the scientific evidence, and it is proven beyond doubt, because this is not done during the COVID time. It was actually published during the SARS outbreak in 2003, 2004.
Can I add to that by saying that perhaps we need to tell the parents, given the concerns expressed by both the doctors, that the children actually carry extra masks with them in a Ziploc bag, in a bag of some sort, and that when they come into school, they discard the mask that they have worn en route to school and put on a fresh one for the duration of the time they spend in school. I think that's something that we may have to insist upon, so that the mask hygiene is also maintained. There's also the issue of how to handle the mask, how to wear the mask, and also not touching the mask throughout the day, because that can increase the contamination. But maybe we need to make a note of this and write to parents saying medical masks are permissible, cloth masks are permissible, but not to go for these sophisticated masks which might restrict breathing. And another question related to masks which you might want to answer is whether a shield is as protective as a mask is, because we've been told that people with asthma conditions may prefer a shield. But whether the shield is as protective as a mask is in the long term.
Okay, actually that was my next question about the mask. Which mask is recommended for children? They're going to wear it for a long time. So I think that answers the question to the parents. Other is, Warden, do we have stipulated time frames for the school times, opening and closing?
Well, we remain at 7:30 to 1:30, but when the whole lot come back, we are going to have to see how we can stagger it. The intervals are staggered, so the intervals don't take place at the same times. So we actually need to have a plan in place for the closure of school, and I mean even the starting perhaps as and when. Again, that's something that's going to be decided over the next few days.
Okay. There was one question from a parent, because there one parent staying at home, other working, right? So sending the children to school, how that can be sort of mitigated with online studying continuously. But I think we are thinking of doing it on staggered basis, right?
Yeah.
Okay.
Bimanta, if you can take that question, Warden's asked about, like, okay, if a child is having asthma, right, and any breathing difficulty, is the shield effective?
I assume this is the shield covering the face. Now, the shield covering the face protects only the eyes and direct droplet inoculation only. So face mask is still the best. So the statistics show that the face mask, let's get things very clear first. Why do we wear a face mask? A face mask is worn to prevent another person getting an infection if you have it. It's not vice versa. Okay, that's the first point that needs to be cleared. However, when you wear a normal face mask or even a visor, that should not hamper your respiration. Even over here, we do see children wearing face masks, even if they do have asthma. But if it's a cotton mask, it's a cotton face mask, and that should not hamper. Using a visor is okay. If the child really can't, the schools here have given that option that they don't need to wear the face mask. However, they can wear a visor, but the visor really does not protect that well. The visors are mainly for the eyes, and that protects only 4%. Face mask will protect you up to 70% if it's a cotton face mask, and a surgical face mask up to 90% if worn properly. I think that answers the question.
Absolutely.
If I may add something to that, the only advice for not to wear face mask is for children who are having severe respiratory disease. This is not, you're not talking about asthma, children with asthma who is well controlled on inhalers, not those children who have like severe respiratory disease, who needs frequent nebulization, who have to be kept at home, who has a lot of breathing difficulties. So the issue is those kind of children should not actually be attending school at this point of time. So they should probably be on the safe side, stay at home and follow the online teaching and things. For everyone else, the general mask that we use, a cloth mask and a pure and simple surgical mask is good enough. But I think we might need to make this point. Surgical masks are not really essential. Simple cloth mask would do, and probably we have to think about the money spent by the parents as well. So it might be more economical to wear the cloth mask and properly have proper washing methods. For 99% of the children, mask will not cause any issues.
Thank you, Doctor.
There's a person with the hand up, Kendall, Channa De Silva. I wonder if he has a question related to the same topic.
Yeah, Channa, you can ask. I have given you the option to unmute. Channa.
Okay, carry on. He doesn't seem to be there.
Okay. Right. So then can we go to any other questions to that?
I have two more questions.
Yeah.
One is one parent wanted to know what is the status of the medical staff at college in case of an emergency.
Dr. Ashan, can you update on that?
Okay. So right now, I think we are one of the few schools blessed with a permanent doctor in-house. So we have Dr. Suresh at the sick room, who would be handling each person, each student that's coming through to the sick room will be triaged by Dr. Suresh as the first contact. And that will take place outside as advised even by the WHO. We will not be taking in the child inside the sick room, and rather there'll be a tent outside, well ventilated. Dr. Suresh would do the initial triage and the child will be dealt as necessary. And if there is any issue, Dr. Dilhar is mainly handling the COVID-related preventive methods at the Kaluboville Hospital. Dr. Dilhar Samarera, visiting physician who joined us for the teacher training program, and he will be there as our primary contact, and Dr. Kapila will be more than capable of handling it at the administrative level. If anything needs to be done, the best resource pool is there with us. And the protocol is that we will follow the protocol, even though we do have people who can get things done. The protocol is to call the 1390 or the 1999 number, get their advice, and then do what is needed. Because at some point, due to some coincidence, something doesn't fall in line, they will always come back to the college and start throwing the blame at us. Because the bigger we are, the harder they want to hit us. So we will follow protocol, but on top of that, be assured that we have the best possible scenario to handle the situation.
One more question. One more question is now, since we are election center, after the elections, what is the plan on the sanitization?
Well, as I said, after the election, we will be closed down. So all the facilities, the classrooms, everything will be completely disinfected following the process that we are going to use.
And also keep in mind that this virus, the research has shown that the viability in an outside environment is pretty low. So by the time the school reopens, even without sanitization, the whole place should be sanitized, because one way is to keep it out open for 3-4 days, and the viability of the virus has shown to be very low after that, even in a cold country. But in a hot, humid country like ours, it will be very minimal. But we are taking the extra precautions here.
That's all from my end.
Thank you, Siddharth. Thank you, doctors. Okay, can we go to Kanchana? Kanchana, is there any questions from your group? Kanchana? Kanchana, are you here? Okay, then can we move to Nirmali? Is there any questions from Nirmali Senratna?
Yeah, there are four. One
Yeah.
is the impact of not wearing a mask, I think, which has already been answered. And Doctor, like, is there anything else you want to add? Because one parent asked, because he has a small kid, it's very difficult for the kids to wear the mask and wait for a long time. So he has a concern that he wanted to know the impact of not wearing a mask.
Okay, I'll start off by saying one thing is to check the child, like at school, this is the recommendation worldwide. Ask them to wear the mask and go around, like, walk a bit and run a bit and see whether that person becomes breathless. It can be mainly psychological. When you put something on top of your mouth and nose, you feel like, okay, you're breathless. But that might not be the real situation. And as Bimanta said, it's not necessary for them to wear a surgical mask. A cotton mask that is easy to wear, not so tight that's tightening their nostrils, right? You can get something like that and do it. So the recommendation is that they have to wear a mask, and we will follow it. So yeah, not so tight that.
Yeah. Nirmal,
May I add to that, please?
Yes, Bimanta.
Yes, I think Ashan, there were a few more questions which came regarding this. I did mention that wearing the mask properly. So there was quite a lot of parents who asked how to wear the mask properly. I think the Ministry of Health has put out some videos in this regard. Am I correct?
Yes, and I was one of the people who came on this thing. So yeah, I can do the demonstration and give you all a video recording. So yeah, so it's quite simple, but like we'll do it on some other time. We'll send a form and communication on that.
The next question was regarding what I need to point to these parents is wearing the mask is important, but more than that, hand hygiene is very, very important. Wearing the mask is one thing. Touching the mask and touching your face after that is another thing. So that is some, I'm telling you through experience over here. They trialed this initially with our children who went to school while the coronavirus crisis was going, and they found out that children really don't listen to what the teachers say, that they always would touch our faces. If we see even adults, it's natural that we touch our faces at least 5 times per hour. This is shown to in research. So this is the reason why we need to be a little more active about it. If you're wearing a mask, you will touch it. Eventually, all children will touch it. That's why we have to inform them, please wash your hands before you touch your eyes, especially touch your eyes or your nose. And especially once you remove the mask, they have to wash their hands, because otherwise they'll just touch their face and they become vulnerable. So mask is a double-edged sword, but we have to go with the guidelines. So at least hand washing is absolutely important, and simple soap is the best. It's good to use hand sanitizers. However, if you are using hand sanitizers, another thing which we come across here is if you just use only the alcohol-based hand sanitizer, that also could be harmful to you. Make sure you do wash your hands with soap and water. I think that's a basic message I can give.
Thank you. Nirmali, any other questions other than what has been asked?
Yeah, there are 3 more. One was, but there was a concern about the height of the pedal-operated swing. As far as the smaller kids are concerned.
I saw the smaller pedal-operated things. I think Subodh can explain that. It's already here.
Yeah, so we have different sizes. Normally, obviously for the senior school and the teachers, we have the bigger one. But we also have the very short ones which are donated for the use for the nursery and the lower school, which will be fixed at the time those grades are required back.
Okay, so thank you. And then there was a concern about whether it's possible to maintain the distance in smaller classes.
What can you take that?
Yeah, so for the moment, what we're doing is we're bringing an entire grade back, and that entire grade back, so 180 students, instead of sending them to 6 classes, we'll be sending them into 12 classes. So it's we will have only 15 students per class, and all the classrooms have already been distanced, so there is 1 meter on all around each person. So it's all well and good for the moment. For even until middle sixes coming, I think we're okay. But once the rest of the school comes back, I think it's a universal problem which all the schools in this country will face, because no school will have enough classrooms to accommodate only 15 students in a classroom. So by that time, if we are to bring back students, we will definitely have to go into a blended learning scenario where 50% is in school, 50% is at home. However, we haven't thought that far yet, because we need to first iron out the nitty-gritties for the actual grades coming back. So once we have done that, once we've evaluated what's best, we will keep the parents informed.
I just got news, Dr. Ashan, some breaking news on news that there's an 11-year-old child in Rajangane who has been found to be positive.
Yes, Father. I think a counselor from the rehabilitation center from Rajangane was tested positive in the afternoon. So then they have started the contact tracing of that particular counselor as well. So these would be the cases that will actually raise the issue. So
the entire class, the boy belongs to a class of 70. That entire class is in quarantine now, apparently.
I didn't get you, sir.
That whole class to which that boy belongs in that school apparently is in quarantine now.
Oh, yeah. I think that should be the case. And ideally speaking, all these places go into a controlled shutdown. Dr. Kapil.
Yeah, I think not one child, that per 2 children, and both children were tested positive.
Right, sir. So I think Sir's line got disconnected.
Yes, I think this happened in the morning. This is the counselor's children, 11-year-old and I think 1.5-year-old. Both were tested positive. Both came up positive, and the 11-year-old has gone to school last week. So basically all the contacts in school were taken to self-quarantine, basically.
Right. Nirmali, any other questions?
Yeah, there are 2 more. One, like whether the college would implement the rewarding system, which was mentioned earlier in the discussion.
I don't think Thomas's would. I think that will be up to the parents to teach the kids and send them to school, because I don't know, someone should be able to take that question, but it will be practical for the college to do that.
So I joined the meeting late, so I don't know what the rewarding system was.
Yeah, I think we'll roll on that. No, the thing was, it was something where if the children keep the hygiene and do their practical things, there was some kind of a reward going to be given.
Oh, I see. I don't. Perhaps a pat on the back without touching might be the way to go.
Sponsor a gift.
Yes.
Okay, one last question. Yeah, one last question. Will the temperature checking be continued in time to come? That also came from a parent.
Yes, that will continue. That will continue for as long as it's required. Where until we get a green light from the Ministry of Education saying temperature at the entrances is no longer required, we will continue to do it. Right now, we're going on the circular which is sent to all schools to say that these are things which every school needs to implement. So that's what we have implemented and beyond. So until the Ministry of Education themselves give us any other indication, we will have to stick by the rules given to us.
And I think some of the things that we are doing right now, it's good to continue things like even hand washing, right? It doesn't do any harm to the child, and schools are known to be places where the disease spread is very high, and the school attendance and everything will go up if we continue the good things. The sinks are there, there's no point getting rid of them. And even the temperature checking, if a child is actually having fever, there's a very good chance they will go to the class and infect the others as well. So I mean, moving forward, even when time comes, it will be worthwhile considering to continue.
Yeah, I think that's a very good point, because even in hospitals we notice that because we have there is a lot of hand washing going on, other infections are quite low, comparatively low. So things like hand washing, having sinks in many places is something that we should really think of doing in the future as well, when this whole COVID issue has gone away even.
Nirmali, any other questions from your group?
No,
Okay,
no,
thank you,
that's all.
Nirmali. Okay, next is going to be, yes, sorry.
Yeah, I have a question. One of the main stakeholders of the college and the PTA are the teachers. So I think this question is very relevant, asked by one of the parents. What precautions are taken to safeguard the teachers?
Same precautions have been taken. Yes, Sapan.
Yeah, so right now what we have done is we had a full week of training sessions for teachers, right? And the training sessions were based on a lot of things, from the procedures which are expected to be followed in school to having a healthy mind in a healthy body scenario, where we talk about people's mental side as well. Both teachers, parents, and students, all three of them. And of course, the doctors came and spoke to the teachers and told them about proper procedure to be followed and how to look after themselves. So they are well trained, if I were to say. They're well trained in this scenario, so that they know what to expect and how to get about to do things. The teachers, being the adults, they will technically be the front line for us. So they will be at the gates to take the temperature and all that. But they too will have to fall in line with the hand washing, with the wearing of the mask, and all that, right? So basically, everyone in the school community will continue to practice these the best practices, and to look after themselves. But the teacher is the person who needs to train the kids. So when the teacher goes into class, the first time they go to class, they probably tell the kids, this is what the coronavirus or the COVID-19 virus is. This is how it's transmitted. This is what you need to do to look after yourselves as much as the person next to you. So that is what is happening at the moment.
Thank you. So can we move to Father Roshan? Father Roshan, if there was any questions other than what was asked, if you can pose it to the doctors panel or to sub-warden or warden. Any questions other than what has been asked already?
Father Kendall,
yes.
Can I come in for a second?
Yes, go
Father
ahead.
Kendall?
Yeah.
Actually, yeah, it's. I was in touch with some of the educational people as well, some of the directors, and as we are going along with the guidelines of the education ministry, they too are taking it, one step at a time, and they will also the guidelines will also evolve during the next few days. So we will keep in touch with the guidelines given by the education ministry, which will also evolve. Not the guidelines. Today's guidelines may change tomorrow.
Okay. Thank you, Doctor. Father Roshan, any questions pertaining to what we can ask the doctors? Anything beyond?
Pastor Kendall,
Pastor
Father Roshan
Yeah,
has
sorry.
left. He had
Okay.
he had to leave early. I think he has left. So we have to move on.
Then can we
All
ask
questions were
refuge?
answered, Pastor Kendall.
Ah,
All
okay.
questions were. Yeah.
Thank you,
I'm
Father
leaving.
Roshan. Okay.
Okay.
Refuge, if there are any questions other than what has been asked?
Yeah, most of it has already been addressed. There are a few fast, like short answer questions, mainly directed to the panel of doctors that we have. One is it airborne? There is a discussion about COVID. So can you give a fast, quick answer, I suppose?
Yes, I think one of the papers that I showed you, that papers by the WHO, one of them is regarding the possible aerosol spread. So, like, just to be brief, what is aerosol spread and what is droplet? Any particle that is less than 5 micrometers, like the particle size is considered aerosol. The other ones are considered droplets. So the droplets, they say, travel only about 1 meter in our setting, like, but like as Bhimanta says, in cold countries, they are considering the 2 meter radius, which is the safe distance for a droplet to fall. And the aerosol generation up to now by research has been proven to be an issue in settings where certain procedures are being done, especially in the medical scenario. Within the ICUs where there's intubation, when there's the suckers are operated, when there's nebulization is taking place, these smaller particles are generated and they're suspended in air for a long time. And in some instances where there is a lot of sick people in the same place for a very long time, they have shown in some instances a certain amount of virus there in the air. But they have still not shown whether there is there's a viral load enough to infect a person. So therefore, they have finally given a few recommendations which I listed on the presentation, particularly for that purpose, and in that they have not mentioned that people have to take precautions for aerosol spread. If that was the case, everybody will be prescribed to wear a respirator. Right? A respirator is the only thing that can actually filter out aerosol. The surgical mask that we wear, the cotton mask, will not be able to from the infection. So therefore, if there is no necessity as of now, because the research is on a real-time basis right now, the WHO has not recommended any precautions to be taken by the public to stop the aerosol spread. But to be on the safe side, it's best to stay in places which are well ventilated, that is open to the outside, rather than in small crowded places where these controversial scenarios has taken place. So,
okay. Thank you, doctor. The second question is, can an asymptomatic person transmit the disease completely to another person?
yes, again, from the same document that I shared, I think I can share those 2 documents. They have said it is extremely rare that an asymptomatic person spreads the disease, but it does take place, right? So it has specifically, due to the rarity itself, it's not a major issue, but given the large number of people who are having the infection, asymptomatic spread is something that we need to consider. So yes, within the first 3 days before you get the symptoms, also you can spread the disease. That is the reason why we are asking everyone to practice the preventive methods, so that even if you are asymptomatic, you will still not give it out to someone else.
Okay. Thank you. A third question is, if there is a child who has sensitive skin and is unable to use hand sanitizer, is there an alternate or an option?
I think Bhimanta gave the perfect answer for that. Soap. Like, I mean, if you can't use the normal soap, go to baby soap, because that's like the usual recommendation given by dermatologists when you're having sensitive skin, and we don't have any dermatologists here with us.
Yeah, I have an addition to that. They do recommend even here, I mean, even for us, because we do a lot of aerosol generating procedures and we change a lot of masks very frequently. So we wash our hands almost every half an hour sometimes in the hospital. So even for children in school, they have recommended, especially children with sensitive skins or anyone, wash your hands with soap and water, and also apply some moisturizing cream at least once or twice a day, especially for children with sensitive skins. So that's it's just to keep your hands not too dry. That's all.
Thank you, Bhimanta. Thanks for that. There was one question addressed towards Dr. Kapila. The question was, can we ask Dr. Kapila what stage are we in as a country currently? I don't know. Dr. Kapila.
Yes. Now, can you hear me?
Yes.
Okay. So we are actually at the moment, it's not that severe. What happened was now up to 2 days back, we were in a very good situation where we didn't have any positive patients, but suddenly, as Dr. Ashan said, we have these clusters coming up, once in a way. So this is one of the clusters which came up through this Kandagadu rehabilitation center and the quarantine center, but it's all under control at the moment. So and the health ministry officials and the army and the intelligence services are active, and they are trying their best to. Most of them have been found out who the contacts are, so they have been quarantined, and so far it's under control. And there are some more contacts to be found out. I think by about today and tomorrow, all these people will be quarantined properly. So at the moment, we are still okay, but then we need to be safe. Okay?
So just to add to what Sir said, have to understand most of these people who are diagnosed are asymptomatic, right? Not the people who are actually requiring ICU admission or anything. Just because we tested them, they have been found to be positive. So, we can't go into detail. I think we have some of our Ulvas who can explain it better than us, but unfortunately they couldn't join today. But there have been 3 main strains they're talking about, an A, B, and C. You might have seen it on the internet also. And the genome sequencing done in Sri Lanka has shown the ones that were found circulating in Sri Lanka are all type A, which is actually not giving the full-blown disease and giving a very low level of infection. Most of them are asymptomatic. And so that is something that we should be thankful for, the situation that's happening. And hopefully if that continues,
Also,
it's not a major issue right now.
Ashan, and also just to add to that, now I heard this one of the parents saying that it's reported that there are cases coming up all over the countryside, but actually the cases, they are not cases actually. The positives have been very, 2 or 3 people, other than the set of people who have been at Kandakadu rehabilitation center, who have been found positive outside that. But most of these cases, or these supposed to be cases, are all contacts, not positive people. So it's not patients, but contacts. So and all these contacts have been identified, and they have been quarantined, and they will be followed up for the next 14 days. And all these contacts will undergo a PCR test within the next 2 days.
Can I add something just from my experience while I've been here in the UK? I think why Sri Lanka has done so well is we have enforced a lot of rules and regulations by force to maintain social distancing and face mask and hand hygiene. Now, I'll just give you a rough thing. I possibly got COVID-19 somewhere around March, and subsequently my whole department got it. I probably got it from a nurse who was in ICU for 2 weeks. However, when we were tested, some of us became negative. Some were admitted in hospital, but they were still negative. All of us underwent antibody tests, and all of us became negative except for one person who was asymptomatic. Now, does this ring a bell? tests can be positive, tests can be negative. But the take home message what we were taught is don't rely on any of these. You have to rely on basically your hand hygiene, your social distancing, and wearing the face mask and avoiding coughing at others. That's why you basically wear a face mask. So this is the important thing. I know a lot of people are quite worried in Sri Lanka when 1 or 2 tests come positive, because obviously here when we say 100 patients are positive, we really don't care now because we see so many of them. My consultant was positive, he was tested positive, and I was with him for 3 days continuously. Hence they tested me, I became negative for the second time. This was just 3 weeks ago. So this rings a bell that you should not go only on tests. The government is doing its maximum, and you have to applaud for that. They are doing the maximum, but this is still a new disease. We really don't know what is happening. As I told, we are talking about antibodies. Now they've come out telling that 80% of patients who have had disease are having negative antibodies in this country. So these are all things which are emerging, developing. The take home message is you need to actually just take care of yourself and enjoy how, when we can. That's the most important thing. If we are to take this as a sad and sorry situation, we can live a sad and sorry life. That's the basic take home message.
Refuge, yes. Any other questions, or we can hand it over to Chintaka to close?
No, that's all mainly from my end.
Okay. Thank you. Chintaka, over to you. Dr. Spanel, thank you very much. A brilliant enlightenment to our parents and clearing the fear. So Chintaka, over to you.
Thank you so much. I think we had a very educational and a thought-provoking webinar. So my thanks goes to Warden, Sub-Warden, Father Roshan, Father Kendall, and the panel of doctors, Dr. Kapila Kannangara, Dr. Ashan Patirana, Dr. Dimantha Pereira, Dr. Sanjeeva Gunasekara. I think you did a wonderful job. Thank you so much. And to all the parents, if not for you, and we cannot have this webinar. And there also to all my PTA members, thank you once again. And we will be having several webinars of this nature in the coming weeks. So we urge you to pass the message. Today we had 240 participants. So we expect bigger numbers in the coming webinars. So pass the message and we'll keep you posted. So good night and stay safe. Thank you.
Thank you.
Can I say something before you close?
Yes.
The recording, can it be shared, please, Pastor Kendall?
Yes, can be done.
Because the heads of some of the schools have asked whether they can have a listen as well to the recording.
Okay.
Okay. Thanks very much, everybody. God bless you and good night.
Good night.
Good night. God bless you.
Good night.
Okay.
Thank you, everyone.